There are two or three things that I think are really key and fundamentally important to the future of our state. One is the health of our citizens. And the Friedell Committee for Health System Transformation is a grassroots based initiative to help, as the title implies, transform the health of Kentuckians and the health system. So why don't you all come on up?
Good morning. My name is Carolyn Dennis, and I serve as Executive Director of the Friedell Committee for Health System Transformation. Just a few days ago, the Commonwealth Fund released the 2009 State Scorecard on Health System Performance. Since 2007, Kentucky has dropped from 43rd nationally to 45th overall. Let's put it this way: we have many opportunities for improvement. Let me tell you about some people who are working to engage citizens and communities to improve health in our state. The Friedell Committee is a statewide, independent, nonpartisan, nonprofit citizens committee whose goal is to improve the health and health care of all Kentuckians through the use of values-based principles to transform the present dysfunctional health system, if indeed there is an existing system at all, or simply a series of health silos, each operating independently of the others. The Friedell Committee is the only independent organization in the country primarily representing citizens and community interests as we take a unique approach to healthcare reform through the establishment of values-based principles rather than focusing on healthcare costs alone. You'll note when you look at the brochure in front of you that in the 10 principles that cost is certainly a factor, but it's addressed from the citizen's perspective of affordability rather than as the sole tenet of healthcare reform. Most will agree that, even if universal healthcare was available tomorrow, that alone does not ensure such things as quality of care, efficiency, respect for individuals and their families, or accountability to the public, to name a few of the values deemed important by Kentuckians. This unique approach to healthcare is modeled after the Pritchard Committee for Academic Excellence. As you know, to address deficiencies in the Kentucky educational system, the Pritchard Committee pioneered the idea of developing a citizen-based group rather than one composed of only education professionals. We follow a similar model by striving to ensure that at least 75% of our committee members are not active health professionals, but citizens representing a variety of backgrounds, locales, and interests. Much of the success in landmark education reform in Kentucky is rightly attributed to that committee's work over the past 25 years. Given the complexity and parallels of both education and healthcare reform, and the necessity for public involvement in each of them, a similar approach has been taken to establish this organization. Our mission is to improve the health of Kentuckians by advocating for the initial and continuing inclusion of values-based principles in a transformed high-performance health system. This organization was founded by Dr. Gil Friedell, whom you'll meet in just a few minutes. We were originally called the Kentucky Health Values Initiative, and over his protests, the board voted to rename us the Friedell Committee in his honor. The Friedell Committee's commitment to healthcare reform stems from specific health concerns among Kentucky's families and communities who find the present healthcare system dysfunctional, fragmented, and inadequate to meet their needs. Our origins stem from events beginning in 1992, when under Governor Brereton Jones' administration, some 5,000 people attended community health forums held in all 15 ad districts across the state. The following year, Dr. Friedell and others requested that the 2,000+ pages of transcripts be analyzed to identify the values implicit in those discussions. These are quite similar to the 10 values you see listed in the brochure you have and on the screen. In subsequent public meetings, we have reconfirmed that these values are what Kentuckians still want in a health system. Health systems are accountable to the public in every aspect. Health systems are responsible for promoting the health of individuals and populations throughout the entire lifespan. Health professionals and systems are responsible for providing safe and quality care. Each individual has equal access to effective care without regard to race, gender, culture, geography, or socioeconomic status. Care for each individual is safe and of high quality. Care for each individual is affordable. Care for each individual is efficient and of high value to recipient and family. Patients are treated with respect. Patient rights are clearly expressed and honored. Individuals and communities share responsibility for their health and for the cost of care. These principles will be used by the committee in 3 ways: as benchmarks for evaluating the current system, as foundational elements in system transformation, and as criteria for evaluating progress over time, that is, providing oversight of the transformed system. The 10 principles with specific measures that individuals and communities might use to assess and evaluate existing programs are being utilized currently in pilot projects looking at diabetes in 3 eastern Kentucky counties and in access to K-CHIP in 1 central Kentucky county. Additionally, various work group projects are focusing on defining model accountable health communities, diabetes as a chronic disease model, the role of public health departments in the health of the community, person-centered health homes, and child health, focusing on K-CHIP specifically. As I mentioned earlier, our committee is composed of dedicated lay people with an array of backgrounds and geographic locations across Kentucky. All members are leaders in their communities, and all have a passion for improving the lives of their fellow Kentuckians. If you know of people who might be interested in learning more about our committee, I urge you to contact me via our website, www.friedellcommittee.org.